Welcome to YourFourSafe.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Of course, he's our specialist on foot and ankle conditions. Nice to see you, Dr. Michaels.
Thank you, Angie.
We want to know, what is a bunion?
A bunion is when the big toe turns over towards the second toe, and it's a very painful condition that affects a lot of people. It's caused by genetics. If you have family history of this, then you're more likely to have it. Some children get it, adults get it, people with flat feet can get it as well. Here's a model, and if you look, the toe is fairly straight in the model, as it should be, but if you have a bunion, the big toe turns over towards the second toe and becomes crooked. And as this becomes crooked, it could cause a lot of different structural problems with the foot. A lot of people put up with this pain, and they don't have their bunions fixed. And that's okay. You shouldn't have the bunion fixed if you don't want to, but surgery is not always an option. There are other treatments.
So, Dr. Michaels, what are the treatments for bunions? Well,
there's conservative and surgical treatments. One conservative treatment would be wider shoes. If you have a bunion and it's sticking out towards the inside of the foot, wearing a wider shoe would help accommodate that. And if you could get away with wearing shoes that don't hurt, then that's all you should do. You shouldn't have surgery on a bunion if it doesn't hurt. There's another thing that you can do, which would be a custom orthotic device. And what that can do is raise the arch a little higher on the inside part of the foot, and that can help take away some of the bunion discomfort, but it won't fix a bunion. There's also a brace that you can wear at nighttime that'll pull the big toe back over where it should be. Instead of it lying there, it'll lie over here. Now that does not fix a bunion either, but it can help accommodate it and take away the pain. You sleep in it at nighttime. Now, if none of those things work, then surgery is indicated. And a lot of times now, the surgeries have been perfected where you don't have to be off your foot. It's a same-day procedure. It takes about a half hour. You do have to wear a special shoe to walk in for about 4 to 6 weeks while the bone heals if your bone has to be cut. And sometimes that's necessary. We try to do procedures where people can get back on their feet and back to work without a lot of time off. So that's pretty much how you treat a bunion, but again, it should only be done if you have discomfort or pain, not just because it doesn't look good.
All right, thanks so much once again, Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Don't forget, you can ask your questions about foot and ankle conditions only here on Your Fourth Date.